Hey Terry, welcome. So I want to welcome everybody here today to our little interview with Joel Willis. I'm going to spotlight him in just a second. Joel is a longtime family friend of the Coltrip Plan, and he is also a physical therapist for the last 18 years. He looks like he's not old enough for that, but he is. Welcome, Joel.
Hey everybody, good afternoon. Nice to be here with you.
Thank
Can
you
you
for
hear me okay?
joining us. Yeah,
Yes, okay.
great. I think that probably with our group here, we have a lot of neck and shoulder pain. And when I saw your post on Instagram about that, I said, I need to get him in here for my peoples because we
Glad.
need some help.
I'm glad,
So,
yes.
how long? Tell us about your being a physical therapist.
So yeah, I've been full, just to kind of back it up a little bit. Let me see if I get everybody in my view because I hate to look at myself when I'm
Sorry,
talking.
I
There we go.
spotlighted you.
I'm just looking at my big shiny head. Don't see, don't need to see that. All right. So yes, hey everybody, Joel Willis here. Been in the field of physical therapy, practicing as a physical therapy provider for just about 18 years. So I did graduate young. I went to school at Loma Linda University, which is a healthcare private university college in California. I did not go through their graduate or doctorate program, which now is what you need to actually become a PT. I was an undergrad, so I did an undergrad study there, and as a result of that, had enough units to sit for my physical therapy board as a PTA. So that's the license that I hold in California, which is the provider that if you go see a physical therapist for any injury, you're generally going to be working with one of us as your provider for the duration of your treatment as we progress you towards your PT goals. During that period of time, I have worked in a really, really eclectic variety of settings, which is something I really enjoy because initially I went into the field most passionate with kind of this sports idea, young, athletic population. And then into that, after a couple of years, which was a great learning experience, I migrated more toward your older to geriatric population, worked more in an inpatient rehab, that kind of setting for a while. Then for the past, as professionally for the past 12 years, I've been in home health care, in which case we see every gamut of individual after coming home from a replacement, knee replacement, hip replacement, shoulder surgeries, back surgeries, and then just general illness altogether. Through that process, my wife and I also are very involved in the deaf community as a result of our ministry. So that immersion in the sign language and deaf community caused us to look into that as a side profession. So we became licensed certified American Sign Language interpreters, which opened me up to the world of how much interpreters deal with strain and muscle related injuries that are from multiple use, as all of us do, but interpreters specifically because we're always holding our hands up there. And so that caused me to start putting on workshops that integrated my background in physical therapy to the interpreter profession as well. And then I developed a specialty in ergonomics and posture as a passion, and did a lot of like on-site visits, working with different companies, helping them to develop a bit of an ergonomic background and an ergonomic platform, doing workshops like this, educating their employees on how they can get a better workstation, alleviate stress, next related stress, and that kind of stuff. So that's a little bit about my background. That way, I'm also a husband and father of two. So my wife and I homeschool our kids. They're 9 and 6. So that is pretty much, we both do that together. So that's our big job. If any of you homeschool, you know how challenging that is. We have loved to travel for many years. So we've lived in a few different countries. Right now, we currently live in Merida, Mexico, which is super south, kind of on the same latitude as Cancun. So it's a large city in the Yucatan. It's actually the capital city. We moved down this way so that we could just kind of disengage a bit more from the stress from everyday living in California, the expense, and be able to simplify our lives a bit more, focus on our kids, our health, and our spirituality. And And that's where we are now. So that's taken me more to a virtual platform when it comes to my physical therapy services that I offer. So like Lori mentioned, I have an Instagram account that I just focus on doing small videos, tutorials, engaging with kind of my small community network of friends who need help. And then I'm kind of in the fledgling stage of developing that more. See a little bit of my website behind me, virtualtherapyworks.com. You can go to that website. Feel free to follow me on Instagram, which is also my handle, Virtual Therapy Works, VTW, Virtual Therapy Works, on Instagram. And there I just kind of hope to provide a lot of accessible information to as many people as possible, just to give tips, post maybe weekly small videos, answer direct messages, questions, and then just use that as a segue into, if people need a little bit more personalized questions and plans and things that that they can do at home. Because if you've ever done physical therapy before, there's so much of it that you really is up to you as an individual, as healthcare is in all aspects. A clinician, a provider can do this much, and it's up to us to bring it to the table. So physical therapy is really the same. There's a lot of hands-on techniques that you really do benefit from having a therapist work with you one-on-one, but so much of it has to do with our carrying through what we're taught, our home exercise programs, and really being diligent and consistent with that. So I'm really passionate about exercise and ways that exercise can be a part of anybody's lives. My favorite population group to work with is in the group of between 40 and 70. I love all ages to work with. There's something fun, there's something neat working with all groups, but between 40 and 70 is just such an interesting category because you can see such variety in what we can physically do. And a lot of that has to do with just knowledge and education. As we are middle age and right in the heart of middle age, find that to be such a essential period because it can really make or break the rest of your life, how you're going to be able to function and what remains of this vessel that we have at this age. Things start to break down, things start to deteriorate. So a lot of things that people can do on an everyday basis to really maintain and just get the most out of what we're working with, because everybody's working with a different bag of tricks.
I love that you say that. Let's set the stage for the future, because it's very easy to think, oh, I'll deal with that later. How does that go if you wait till you deal with it later? Is it better to deal with it at the beginning?
Oh yeah, it's there's an adage in therapy: make time for physical exercise, therapeutic techniques now, or you'll be making room for the illness that's related to your lack of time very soon. So the time is going to take you. The time that you spend now investing in something that hasn't become extremely problematic, but it's there, is minuscule in reference to how much that time, how much that's going to cost you when it comes to meals that you're not going to be able to cook, houses that you're not going to be able to clean, events that you're going to miss, engagements and activities that you're not going to be able to participate in because of injury and because of pain or because of neglect.
And I think that applies in anything with life. Take care of it now. Yeah. So
yeah, for sure.
I'm assuming that pretty much everyone here has some sort of neck or shoulder pain. What you got for us?
Yeah, and I'm like what's so neat about being a therapist is that you really you work on yourself, and oftentimes you find that you're not applying your own you're not practicing what you teach and what you preach. So a lot of times I'll come in on myself and think, man, I'm feeling this, and oh yeah, it's obvious why I really get it right away. But I think specifically right now, because of the quarantine life that everybody's experiencing, and we're like tied to this is our means of interacting. We're on an all-time high of just neck and shoulder stress because we're all just trying to engage with the people that we love like this. And we're all up in the screen and our heads are protruded super far forward. We're grabbing our devices and we're just kind of doing this is just 20, if we're sleeping for 8 hours, to be honest, that probably is where we spend 16 hours of our day back and forth with our device. And so knowing good hygiene when it comes to engaging with your device is number one. So I think that lays the basis. We're going to talk about a few mechanical things that we can do, but first everyone has to address, how do you engage with your device? So like if you're engaging with a handheld device, and this is stuff that probably many of us know, and it's going to be common sense, but that reminders are helpful. Always try your best to make sure that that device is with you at eye level. So even this right here, this is a huge difference from this in terms of the amount of strain that I'm putting on these occipital muscles and the muscles that go down the upper part of my spine. Of course, that brings into issue, well, my shoulder is going to get super fatigued and tired. So if we're sitting, then we need to prop it. Get a pillow off the couch, get something underneath your elbow to be able to bring your device up to eye level, number one. Sometimes you can do that just as simply as crossing your leg. That can give you the ability to use your knee to be that pillow. That may not be comfortable for super long, but just kind of in the meantime, because every minute counts when it comes to maintaining ergonomics. So that's something you have to realize. We think, oh, I'm only going to be in this position for 5 minutes. That's 5 minutes that you'll be suffering an hour or two as a result of those 5 minutes. So be conscientious minute by minute how we handle our devices. So bringing that elbow up or bringing your device up to eye level is crucial when it comes to using a handheld device, and thinking of ways throughout your day that you can do that. So you're your own therapist when it comes to this. If you're spending time in the kitchen, then maybe you need to come up with a station where you place your device. Maybe that needs to be a part of your kitchen setup. A couple of books where you place something so that when you're talking on the phone, when you're cooking with somebody, when you're Zooming with somebody, that you're eye level with your device. So that's super important. Also thinking when it comes to a computer, if you're working from home, which a lot of us are right now, we're attending meetings from home, doing all that kind of stuff. Again, just think about your setup of your device. So I am a huge proponent of a workstation that lifts and rises. So behind me, like this is kind of my interpreting workstation where I do some stuff, but I have an automatic rise and lift desk, one of those push button ones. Those are that's a lifesaver, but you do not have to invest in an expensive desk. Walmart.com, Amazon has some nice little devices that you can place on top of your current device or current desk that can range anywhere from $30 to $50 and allow you to be able to use a little clip and bring your computer up to chest level so that you can stand for a portion of your work. So if you're working from home, and I don't encourage people to stand consistently for hours, but having the ability to alternate positions between standing and sitting is a really big deal. So that's the first thing, is just thinking about how you engage with your device. That's what we call device hygiene, being number one.
Joel, I read somewhere that when you lean your head forward, it weighs a lot more.
So true. So if you think of how, if you're looking at me from the side, in therapy, we call it a plumb line. So oftentimes we'll hold like a line at somebody's ear, and we want that line to pass from ear through mid-shoulder, through hip, through knee, and through ankle at those 5 connections. So basically, you're all lined up. But every inch that my head is a little bit larger. I feel like I have a 10-pound head for sure. But the average weight of a human head is between 8 and 10 pounds. I got a 10-pounder. Every inch that you are in front of your shoulders increases the weight of your head by 10 pounds. So I'm here, and you may not, and tell me if you notice this. So I'm here, I'm working on my desk, and I'm here. Now I'm at 20 pounds. I'm here, and I'm at 30 pounds. I'm here, and I'm at 40 pounds. I'm here, and I'm at 50 pounds. I'm here, and I'm at 60 pounds. So this is 60 pounds of pressure on my suboccipital, traps, cervical structure, bone structure, impact. So that's huge.
Can that cause compressed discs?
So over time, absolutely, because we're looking at a natural curvature that you're supposed to have of extension in your cervical spine, and when you're out here, you don't have that. You're in this kind of cockamamie sort of extension with flexion. It's really uncomfortable. So yeah, and that prolonged setting will cause compression, and mostly it'll just cause extreme amount of tension and strain to develop through here. And I mean, you felt that it's kind of like a burning feel. It's so hard to explain. It's just it's broad. It's all over. It's just everything feels hot, tight, painful. You can't seem to do anything to relieve it. So we all hear stretching and how stretching is important. Do you want me to go on with this?
Yeah, keep going.
So we all hear.
Sorry.
We all know how
excited.
we all know how important stretching is, and stretching is a very important part of the mix, the cocktail here. But it really is a cocktail that we talked about hygiene when it comes to our device, pot ergonomics. That's a whole nother world of having an ergonomic setup. Can definitely work on that with you on the side. Then you go into exercises and movement, mobility, function. So stretching is important. So there's your normal everyday stretches, which a lot of us have seen or heard, to make sure that you're stretching. You're doing your ear to shoulder, side to side, pulls. You're doing nose to armpit. I like to teach people that one because you've got this muscle group that goes that kind of goes diagonally behind your back. So it's called an armpit sniff. So I'll have people take the opposite arm or hand, put it over their head, put their nose toward the lifted pit, and gently pull down in that direction. And it's important that the other extremity that's down be anchored. So if you can grab on to the bottom of a chair or something with your downward arm, the left arm, like if you're doing this with your right hand, or if it's with your left hand, then with the right arm, but hold on to keep that shoulder depressed, or just mechanically make sure that it's staying down while you gently pull down. That's going to help. And smell that pit. Grab an oil.
It's hard to keep that down if you've got a lot of stress in there, right?
Yeah, so holding on to something is nice. So that's good. So those are some basic stretches, doing that on either side. Everything that we're doing in life right now is flexion positive. So we do everything in this forward zone of our body. We drive. We've got this big steering wheel in front of us. We wash dishes. We cook. We write. We take care of our family. We do, take care of loved ones. We're caregivers. We're cleaning, helping people. So everything is happening here, and this is causing everything just to curve in. So our spine is pulled forward. Our shoulders are pulled close to each other. So one of the key words that we're going to emphasize throughout this is extension, extension, extension. Everything that you should be doing should focus on extension. And you can't say it enough, because everything that you do through life focuses on flexion. So you have to create a balance there. So it can get to be irritating. Extend, extend, extend. Well, every time you live and do, you flex, flex, flex. So you have to do the opposite movement as much as you can consciously think of it, to balance all the tension that's developed in these forward flexion muscles. So these are like your push muscles, these muscles in your chest, your pectoral muscles. These are your big power push muscles. Well, just by keeping your shoulders in like this, these pecs shorten a great deal, and they develop mechanical tension. They become anchored in this position. We've got all of these muscles through the front of the neck. Because we're out here, these muscles tense down. So we have to do everything that we can to promote extension. So some of the ways that we're going to do that, if you're standing at a desk, I'm going to maybe switch over here actually to this one. I never left the group. So I'm going to start the video. Can you guys see me over here?
Yes.
Okay.
Let me spotlight that one.
All right. Okay, I'm gonna turn off my audio here. How is that?
That's good.
So if I'm standing here, this is my workstation, my desk, I'll kind of give people the idea of, it's kind of a theme that your office space has become your prison cell. And you are coming in to accost yourself for your bad posture. So you're in trouble because you've been sitting wrong. So I come in on the posture police, and I say, stand up, put your hands where I can see them. And I use this in some classes just because it helps people to remember what we're doing. So stand up, put your hands where I can see them. So you're in front of your desk, your hands go out on your desk as if you are being accosted by an officer, and this is your first stretch. So I'm just, maybe I'll do it here. It's the same.
Am I the only one doing it? Look, we have a chance to have a physical therapy appointment right here, right now. If you got some shoulder and neck pain, do it, okay? But don't put your chest down in front of the screen, okay? So are we bending our knees while we do that, Joel?
So what I've got going on is I put one foot in front of the other, and the other foot steps back so that I'm in this position that supports my back. So one foot's in front of the other, one foot's back. You can also do this with the back of the chair that you're sitting on. Works great with the back very well. Any solid surface. So what we're trying to do here is open up the chest. We talked about how the pec muscles get super tight and pulled in. This works also, tightens up some of these under armpit muscles. We're trying to open this up a great deal. So we're just going to put our hands flat on that surface where I can see them. You're stepping back behind you so that you're kind of like in a bit of a lunge, a big lunge position. And then we're just going to let our chest body weight drop down and drop your head.
Can you do that on a door frame too?
And just hang out there. If you're tall enough,
like, can you put
top of the door jamb? Most people are not tall enough to reach the top of the door jamb, but you could. This can also be done with just like a simple chair in front of me, where I'm just coming down, and now I've got both feet side by side. The point is that you want to make sure that you keep your back supported. So if you've got back issues, that's why you're keeping that back straight. And we're just going to hang out here for something like 15 seconds. 1, 2, 3, 4, 5, 6, 7, and then slowly walk your way back up. I like to repeat that. People really need to start their day like this. You get up in the morning, oftentimes the way that we're sleeping. Start opening up your chest right away. Another way that you can do this, so we're still in that office corner, we're in our little office cubicle, is get in the corner. Put your nose in the corner. So if this is the corner of my office cubicle and these are walls, then I'm simply going to step in, place my hands on the side of the walls, and lean in.
Wow.
And that's going to allow me to be able to open up my chest.
Oh my goodness.
Really get these muscles. So if you don't have this open, then you're going to be fighting against all this mechanical injury, or all this mechanical tension, so that every time you try to put yourself in proper posture, you're pulled right back.
And it hurts more, right?
Yeah, this forward posture, which is what we're trying to get out of. I also like to teach people to do stuff with like a broomstick, which is everybody has a broomstick around your house. So just grab your broom, undo the handle if you want, if the not the handle, the base, the broomy part, if that comes off, so that you just have a stick. Okay, and then we can use this to help us to promote extension as well, and then to start building up some strength. Now, if you've got a little bit of an impingement, anybody have impingement in the room? I'm looking down at this screen because I have everybody's.
I do.
Lori has an impingement.
What does that mean, Joel? Tell us what that means.
So impingement basically means that every time you try to lift your arm, it's a super sharp pain that your arm has to drop and you can't lift it up.
I have thoracic outlet syndrome.
Okay, different, but also in the same. So I just want to know, so that as you go through this task, if you're having super sharp pain, don't do it. Having the broom to hold on to is sometimes helpful. So as we get ready to go overhead right now with this, let's see if I can bring my camera up with this. As you get ready to go overhead, if this would be painful, you wouldn't do it. But we're just going to bring that bar as far back as you can.
Aye.
As you comfortably can. Oh my goodness. Reba, that might be too much. If you've got hyper joint mobility, Reba's got she's hypermobile. So some people can, you know, so what you're seeing there is not nearly the amount of extension that would be, that you'd want to necessarily do. But we're just gonna come up and let's make sure that it's behind your head. So even breathe up for you, so that you get to control that mobility, because having hypermobility can also work against us. So to control that mobility, let's bring it right here, slightly behind my head, and we're gonna pull this bar down so that it rests on the base of our neck, and then push it back up slowly. And you're creating this kind of imaginary force or imaginary imagery that you're pulling through something thick. And as I press up, I'm pressing a bar that's heavier than it really is. So I'm creating my own tension. Ideally, we would want to be doing this standing up. And as we pull down, the goal is to squeeze the shoulder blades together and pull them down as well.
Joel, that feels awesome, even with my shoulder that hurts.
And the thing is, I mean, that already, if you're already feeling a burn and the fatiguing that happens, so you'll be the one to determine whether or not you do 5 of those, whether or not you do 10 of those. What that's going to help to do is start to wake up these muscles in the back that have been chronically asleep because we've had such negative posture. So over years of this, these muscles throughout the back, for all intents and purposes, have gone to sleep. So really have to wake them up and get them used to functioning when you demand it, which is every time you stand, every time you sit, they're postural muscles. So they're not the sort of muscles that are really designed to go to sleep. In your body, you've got fast twitch muscles, you've got slow twitch muscles, and your fast twitch muscles are the ones that are super dynamic. They're your biceps, they're your muscles that are responsible for kicking, they're your power muscles. But when we're talking about your slow twitch muscles, these muscles are designed to be engaged as your entire waking life. They're designed to be able to maintain tone and rigidity with flexibility without fatiguing. So we have to do a series of exercises that do fatigue them to kind of wake them up and get them used to functioning consistently. And that's a great exercise for that. I'll show you a few on the mat in a minute with the broom, but I do want to show you some nice ways to be able to loosen up your shoulders. So some of you are dealing with like an impingement, and I did a video on this a week or two ago on my Instagram feed that you can check out. It has a bit more detail on it. But it's a super simple way because, again, when you've got shoulder issues, that's going to affect your posture, and you're going to really find yourself like it's impossible to be able to get out of this position. Like every time you try to pull out, you just kind of fall right back into it. So having some means of being able to mechanically help yourself, and the broom allows you to do that. So what we'll do with the broom, I'll take one hand. So if I'm wanting to, let's say it's more my left shoulder that's more limited. You can even test yourself. So let's stand up, or whoever wants to, and do a brief little mobility test to kind of see what your shoulder mobility looks like. So if you're standing with thumbs out, arms at your side, and you're just coming straight up in a little bit of a Y, kind of feel if you have restrictions or limitations in where they are. Which arm, so you can kind of become more conscious of which arm is your problem arm. The other thing that we'll try to do is bring your hands on your waist, put your hands on your waist, like you just hold your waist, and then slowly, I like to tell people to do this slowly, because some people have quite a bit of, and just see how easily you can get your hands in the small of your back, and then whether or not you're able to bring them up a little bit, maybe to your mid-back without straining.
Look at Sharonda.
Go, Sharonda. That's really, yeah, excellent, 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 excellent.
Joel, we have someone that says they have a rotator injury. Are these safe to do with a rotator injury?
If you've got an active rotator cuff injury or tear, you're going to want to consult with your orthopedic doctor to find out what stage your tear is and what stage of recovery you're in before you jump into any exercise program. So
This is Carrie. I'm the one with it happened about 5 years ago, and I was in therapy for like 2 years from an injury. I had multiple injuries from a fall, but the one that's troubling me the most is the limitations I have with that rotator cuff. I can't extend it all the way, and it's really weird because I shattered my wrist. Okay, it's the same side, the left side, and when I just tried the stretch that you were showing and raising that arm, it actually pained the wrist where I had the plate put in.
Okay.
So I would just love to. It's not painful unless I try to stretch it. You know, most of the time it doesn't bother me unless I try to stretch it.
Okay. So Sherry, I'm not able to see you. Are you on the screen?
Oh,
I didn't really want Lori to see me, but yeah.
Hi, Carrie.
Hi, y'all.
So what kind of grip did you have with the bar? Were you gripping the bar with an overhand?
I used my yardstick because it's lighter.
Okay. Everybody bear with me while I look down. And okay, and demonstrate.
I'll set you up here and maybe you can see me differently. Can you see it?
Uh-huh.
This was the stretch. You had me like this and to come up. See, I can only bring it there without pain.
Okay.
And when I'm doing this, by the time I got there, it said pains here.
Okay. Okay. So yes, that was not a stretch, Carrie. That was a mobility test. So basically, that just kind of reveals to you how limited your active lateral extension is.
Yes.
And that you're a good proponent or good candidate for some of the exercises we're getting ready to demonstrate. So pay attention to these next series. Try to go through them and let me know how you fare, okay?
Okay, sure. Thanks.
Okay. Oh, awesome. Thank you for sharing that. Okay, so because it's Carrie or Sherry. Yeah, Carrie. What Carrie's dealing with is what we're just talking about, the rotator cuff or impingement syndrome. What impingement syndrome really is that you've got this portion, this bony part of your shoulder right here, where a tendon that passes right underneath it, it's called your supraspinatus tendon. Every time you try to lift your humerus out to the side, the space there is already very minimal, but it pinches it right away. And depending on the condition of that tendon, if a person has had this kind of injury for many years, that tendon tends to thicken up like a callus. So you know how anything that you kind of wear, it begins to thicken in your body. That's how your body responds to wear, is by laying down more collagen fibers. So what happens, that tendon's even a bit thicker, so it's even more easily aggravated. One of the key things for you, Carrie, is going to really be to try to open up your shoulder girdle and improve the strength that you've got going on here in the back of your in the back of your shoulder blade area, which will demonstrate some ways to do that, so that you can open up that space. When you open up that space, the environment for continual injury is not there. And so what that allows is for a healing period or a window for your body to begin healing itself. Whether or not that's going to be through just staying well hydrated, using some sort of essential oil that's helpful to be able to reduce inflammation and accelerate healing. Frankincense is a great oil that you can use over an area like that. There's a variety of different techniques or ways if you're going to use an anti-inflammatory protocol. But the point is, if you don't fix the posture, the injury is re-happening every single day, even if you're not feeling it. So it's super important for us to be able to fix that posture and open up the mobility of the shoulder. So the exercise that I'm going to show you guys, if you've already identified which shoulder is maybe more problematic, and if both of them feel about the same, even people who have good range of motion benefit from these exercises. So we're going to just take your broom with one hand, put it behind your head, Your palm is kind of facing towards your head. The other hand is going to start as low as you need it to, with the palm out, away from your body. The back of your hand is to your body. Grab. And then you're going to be sliding on the smooth surface of your shirt and using this strong hand to guide you through some more mobility. If you feel like you're getting up high without much of a problem, then you can drop it down a little bit. And now we can begin winging. So then we're going to pull, put some leverage on that upper hand, pulling it over your ear. And as I do that, don't lean forward with it. Keep your posture strong, keep your stomach strong, keep your your chin tucked if you can. And I'm just creating this wing space to further mobilize my shoulder and give it that stretch. Now that stretch isn't necessarily a great feel, but it's a bit of a relieving stretch. And then as you finish an exercise like that, you've created a lot more space and mobility for the shoulder to move in. So that's that one. And then Carrie too, make sure that you're doing this one, where you're putting your hand on the desk that we talked about earlier, to give yourself the mobility that you need in that direction.
Yeah, that one really, I really felt one, and that one really helped me. That's something I really need to do, so thank you for that.
Absolutely, and if that feels a little bit too intense, then put your broom back on and start sweeping your floor. No, you don't want to.
Good afternoon, Dr.
Put your head back on, and what that's going to allow you to do is use it.
Yes, it's actually for your son's appointment for next Thursday, to verify that and to get an email address.
Who's
Who's that?
Okay.
Okay.
here?
Her video's not on, so you have to.
Oh,
Hi, this is Erin calling from Dr. George Jean's office. Just calling to confirm your appointment. It's by video next Thursday.
sorry about that.
Okay. Cool.
That's what I had the non-video participants hidden, and I couldn't remember how to do how to get it back up.
All right. So here you've got the broom that's just going to kind of sit on the surface of the it's holding the broomstick in place. And then you're just going to grab the top, or however far up you can on that stick, and slowly lean down. And I think this is going to be super awesome for you, Carrie. And then just actively open up and build up your extension and your ability to passively get the extension that you need. So try that one as well. Are we all still there?
Yeah, we're here.
Okay, cool.
Everybody's muted except me, 'cause, you know, you can't keep me quiet.
Okay, cool. Stand it.
We have another question.
Yeah.
Are you ready?
Yeah.
Why is my good shoulder tighter than my shoulder that was repaired from a torn rotator cuff?
Say it again, the question one more time.
Why is my good shoulder tighter than my shoulder that was repaired from a torn rotator cuff?
So let's qualify what does tighter mean. Do you mean less mobility? Do you mean more shoulder, like trap tension? Like what's the meaning by tighter? Whoever gave that question.
Oh, Sharonda, you're unmuted.
I guess it's like, I don't know, because when we were doing the exercises, if you notice, like my left arm, which is the one that got repaired, it can actually go up higher on the middle of my back than my good arm.
Yeah.
Which is really weird. So it feels a little bit tighter.
So that basically means that your good arm is not too far behind the injury that happened to your left arm.
Oh.
But the good thing is that you're catching it. You're well ahead of the game. Because
oh my gosh.
Losing mobility is what happens before injury.
Oh.
So every time a joint begins to lose its mobility, then it's prime for injury. And you never know when that injury is going to happen. You don't know if it's going to happen when you take on spring cleaning and you are working that spot on that window and for about 3 minutes, and then bam, you're in the midst of a rotator cuff tear. But addressing the mobility now is going to make it that you never have to worry about it or never have to guess when it was going to happen, because you can be preemptive about it. But oftentimes, because after you've gone through a surgery and rehab, you've just been more diligent about mobilization. I don't know what exactly what procedure your orthopedic surgeon did, but they might have, even when they were in there, done some scar tissue debridement, do things to help mechanically clear out some of that scar tissue that starts to hold it. If the other shoulder hasn't been operated on, then you still have some of that scar tissue. Because scar tissue is, again, another word for just collagen that your body builds up to demobilize you. Because it's like, well, you're stiff anyway, so why are you, we don't need all that extra movement. You never use it. That's the way your body reacts. Like, well, you don't move that much, so why don't we just go ahead and lock you into this position? And we want to tell our body, oh, I do want to move. I need that mobility. I need that joint to function. Give it back to me. And then we have to slowly stretch out that scar tissue and decrease it. If that answers the question.
Awesome
Yeah.
question. Yeah.
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 And then you're overused too, because probably pre-surgery, when that injury was getting really bad, you're more dominant on that side. So that's another reason really using that one a bit more, which can be why also the opposite knee, the opposite hip, the opposite shoulder is usually needs to be rehabbed after you've had an injury on an involved side. Recognize that the other side needs some tender, loving care.
Okay. Thank you.
Yeah.
Thanks for that awesome question.
Yeah. Just really quick while I'm standing, I don't want to miss the opportunity to cue you guys in on the beauty of having a lacrosse ball or any kind of ball. You can use a tennis ball, a baseball is okay. Whatever kind of ball you find. I love lacrosse balls for this. They're the hard ones that seem to really bounce well. Those work too, yeah. And the knobby one, ooh, that's gonna make you scream right there.
I know that hurts, but we got these at Walmart. They're cheap or Target.
So what I will tell people to do is take your ball and you put it inside the sock, and this allows you to be able to control the placement of it, and then find yourself a wall and get ready to cry.
If you use one of these knobbly ones, you might want to put a mat or a towel on it, because it will mess up your drywall.
Oh, yeah, good to know.
Please have that out.
So I'm just going to put you towards my, sorry if it's too much of a glare, but I just want to show you, well, you know what I'll do right here? I'll just turn it like this. That wall.
Can you use a tennis ball, Joel?
So tennis balls are okay, but they tend to deflate a little bit, so they don't give you that constant pressure that you get from a lacrosse or baseball or even golf ball, because they give under pressure, but they're better than nothing.
Okay.
But like you said, yeah, and lacrosse balls, you can get them at Walmart, Amazon, a set of 3 of them for $15. But the reason we like to use a sock is because you can control where it's at. So you just throw it over your shoulder, and I'm going to find that spot right off to the side of my spine. So definitely you're not on bone. We're on soft tissue, and we're going to use this to try to mobilize some of that thick soft tissue between your shoulder blade and your spine. So you just place it right there, and I'm just going to kind of do some little drops and, find a killer spot. Once I find a spot that's really kind of screaming at me, then I can work my shoulder around it. So I'm just using mechanical movement with that hard pressure. And you can give yourself a lot of value. Really, that's a lot of people will come just to their therapist for that kind of soft tissue work. And you can do it yourself, save yourself a lot of money. So that's amazing to have. Invest in one of those. Invest in something like this, where you've got a set of bands that you can put inside of a doorway. And these are going to be super helpful for me to be able to, again, build up tension under tension with these muscles between my scapula, because everything that we're working on is extension, extension, extension. We're trying to build muscle groups that need to extend. You can even, without having anything, in fact, I'll encourage everybody to kind of do this with me, do this rowing exercise. You can stand up and do it, it's even better. But we're gonna imagine that we're holding on to an oar. If you still got your broom, grab your broomstick. So this is my oar. Now I'm pulling the oar, putting the oar at my chest. If you're not holding on to anything, just imagine and just hold on to the air in a gripping position. You're here at your chest level. Now pinch your shoulder blades together. I mean bring them together so that you can feel the pinch of skin, fat, whatever. You can feel some sort of tissue that you're coming in contact at your shoulder blades. Once you feel that connection, you've engaged your rhomboids, which are a group of muscles that help hold your shoulders in place to your scapula. We call that scapulothoracic stability. Super important for your scapula not to be sliding around your rib cage whenever you reach or move for something. Because if your scapula or shoulder blade is always moving, then your shoulder is highly unstable and you're set up for an injury. So here we're going to help try to cure that, or at least get you on the path to curing your scapular thoracic increased mobility, stabilize it by slowly pushing that oar away from you, but keep your blades pinched together the whole time. So you're not allowed to release that tension that's happening right here. So I'm going to show it to you guys from the rear. You might not be able to hear me. The point is, I'm only going to extend as far as I can hold that tension. As soon as I've lost that tension, then that's where the exercise stops. You bring it back to your chest. And you work in that zone 5 to 6 times, 10 times, a couple times a day, until you find that you're able to fully extend and keep that connection. And then you've done something we call neuromuscular re-education, and you've educated a group of muscles to maintain their contraction for as long as you will them to.
And doctors charge a lot of money for neuromuscular re-education.
So here we are. Shoulder blades are pinched. You can see that happening right there. I'm going to push away. And I've been working on this for years and years and years. I mean, I've been working on that for 20 years. I always test myself, make sure I can still do it. So it looks super easy. It's hard. So most people find themselves like, some people find they can't even get their shoulder blades pinched together. So that's the first thing. You really want to train those muscles to wake up and pull them back. But a lot of times, part of the reason they can't pull together or pull back is because there's so much mechanical tension happening here in the pecs. So that's where we come into that corner stretch. Put your hands where I can see them. Hands behind the back. Doorway stretches. Lying supine over a Swiss ball, on a towel roll, on a lumbar roll, anything with extension to help open up your pec so that you don't have that mechanical tension working against you when you're trying to strengthen these muscles. But a lot of times folks can come here and they just stop right there, because then I'll find that they lose their stability. And in a clinic or on camera, I'll just watch those shoulder blades and then I'll cue them up, stop, pull it back, go again, stop, pull it back, because you're paying attention to where they lost the control or stability there at their scapular level. So that's very important, because shoulder injuries that happen here usually are preempted by poor stability there at the scapulothoracic area. So when we say thoracic, we're talking about your whole rib cage. Well, your rib cage in the rear comes in contact with your shoulder blade. They're constantly sliding on each other, or the shoulder blade sliding on the rib cage. So there's muscles around and underneath the shoulder blade that are designed to stabilize, so that every time you reach, every time you grab, this is not just all floppy. It's not just moving, where it's you're the one telling your shoulder blade where to go. It's not just going along for the ride. So you've developed this sort of repetition and this training through these exercises and through this everyday occurrence that now when you're reaching for something in your cupboard, your brain, this is what we call a neuromuscular re-education, because this isn't supposed to always be a conscious movement. At the beginning, it's conscious, so that in time it becomes subconscious, and it's just something your brain automatically knows it's supposed to do. It's healthy. So every time I go to reach, my shoulder blade stays in place. It's not coming along with me. Because if it's coming along with me, you're going to have a problem real soon. So you've got to make sure your shoulder blade stays in place with mobility, with reaching. Reaching back to grab your kids or grab something on the back seat, your shoulder blade's not supposed to be flopping around, but it requires consistent training. So I could go on and on and on about this. Sorry I've already went on too long, but it's something I'm passionate about, and I'm super happy to answer more of your questions, you know, off of this at any time. So reach out to me, and I'll give it back to Lori now. Or any other questions you have, I'm gonna sit down.
No, anybody else have any questions? Unmute yourself or raise your hand or whatever, how you want to do it. Sharonda?
No, I was going to say, I already following you on your Instagram. I found it while you were talking. Yeah, already.
So I want to tell you that I noticed a difference in my shoulder already. I went to the chiropractor on Wednesday, and I asked him, what's the diagnosis? He said it's bursitis and oh, I'm sorry. He said it's bursitis and what comes with bursitis? Tendinitis. And thoracic outlet syndrome.
All the itis.
Yes.
Mhm.
So obviously a lot of inflammation in there. But the thing with the bar going up and down, awesome for my shoulder, I noticed. And then the other thing was the last thing you did, because I know I don't hold it back.
Right.
So that is huge. And I know my pain is all along the scapula and in the front here.
Right.
So that's awesome. Thank you so much.
Yeah, and it's just a matter of being consistent with it. It's something you're going to fall off the wagon with. Don't kill yourself if you miss a day or two. Just try to come back to it. Revisit it. If you follow me, I will make sure you don't forget it.
Could someone send me the information to follow you? You said you're on Instagram?
Yeah, absolutely.
Someone, could you send it, Lori? Do you have
just
it?
type in Virtual Therapy Works.
Oh, hold on one second.
Yeah, just search Virtual Therapy Works. That's what I do.
While they're looking at,
Are we echoing? Is it me?
while they're looking that up, I just want to thank you so much. This was, I could feel it just relieving stuff right away. And thank you for all your education that you shared. Some of the terms I didn't quite grasp, but but I got the concept. So
Awesome.
So you give one-on-one sessions?
I do, yeah. So you can either reach out to me online through Instagram. You can direct message me that way. You can visit my website, which is virtualtherapyworks.com. And I have it up here behind me. That's kind of what it looks like. So if you're wondering if you're seeing the right thing when you go online.
it's real small.
It's, yeah, I'm sorry.
Yeah.
Yeah, it's great way up there.
Okay.
Can maybe share the screen. But yes,
Joel,
it's
I want to say,
virtualtherapyworks.com. And you can
thank
email
you.
me at joel@virtualtherapyworks.com.
Okay.
So I want to say thank you also, and I especially appreciate your preference of your age group because that makes me feel more comfortable.
Oh yeah.
So,
Where it's at. Well, it's I mean, you're at that stage in life where it's like you said, it's just a make or break you. You can there's this awesome opportunity to live a very functional life,
right.
but there's these little things that can take you out of the game completely,
Yeah.
and it's just that much of a contrast.
Right. So I appreciate it. I'll be in touch. And
Yeah,
thank
for
you,
sure.
Lori.
Yeah.
Appreciate it.
Thank
Thank
you,
you.
Lori.
Yes, thank
Thank
you.
you.
Oh,
Thank you
thank
so
you,
much.
Lori.
Whoever needs
Thank
to leave,
you.
go for it. Go ahead and leave if you need to leave. But if anybody else has questions, we'll stay on for a little bit to answer.
Yes, thank you for arranging this, Lori.
You're welcome. I'm
Bye.
happy.
Thank you, everyone. See
Thank
you.
you.
Okay, I have to
Take
go.
care. Thanks.
Bye.
Bye.
Computer.
See
I have a
ya.
Thank
question.
you.
Sharonda's got a question.
Yeah, I got a
go ahead,
question.
Sharonda.
Because after Lori said something about the bursitis, I'm feeling like that's what I had in my thumbs prior to doing the Agile Ease, which obviously, made the inflammation feel a whole lot better. But what I notice is, like, if I don't take it, if I go like a day or two without taking it, I start to automatically start feeling that and it's right in the thumbs, right in the joint bottom part of my thumbs. So I'm noticing when we were doing some of those exercises, we can feel it radiating down to you, all the way down to your hands and your wrist and everything. So I'm wondering if I consistently try to keep up with that pattern of working out, will that help with some of the inflammation, or am I just going to be living on Agile Ease until,
Well, again, your mobility is really interesting because every component of your body is connected. So definitely hands, wrists, tendinitis, overuse injuries of the thumb. I also suffer from an overuse injury of my thumb. And it's something that I continue to be conscious of. It doesn't, sometimes it tires or fatigues easily. But I will definitely notice that everything that I'm doing with my entire upper extremity component impacts what's going on here with my hands. But making sure that you're regularly giving yourself the right mobility movements to increase the mobility there at that thumb joint. I'm sorry, there's a lot of screaming going on downstairs. I hope you guys
Can't
can hear
hear
that.
it.
I
Okay.
can hear it.
There's a 9-year-old getting attacked by a 6-year-old baby brother. So yeah, so tell me again, where exactly are you having your tendinitis?
Right in that little joint, right?
Is it at the fatty part or is it on the bony part?
The actual bone.
On the outside. Okay,
Yeah,
so that's
right on the outside, the actual bone.
Okay, so
right
you're kind
in
of
the joint there.
pointing to the fatty part. So you're still talking about like on the fat pad, or are you more on that, or are you more out here?
More on the corner, bottom.
Okay.
Right down on the bottom.
Okay. Yeah, so that's kind of where I have it. It's that's a tendinitis.
Yeah, where you feel it more when you do like that. You feel it really.
Yeah. So something that I do for that, where's my baby?
Hey, Joel, can you get that from having, like, maybe having less motion in your neck and your shoulder? Can it pinch a nerve and have it go all the way down? Like, can you have
yeah,
that,
so
all of that?
It usually happens because a person has done a lot of flexion activities, gripping activities, but then also people who can be prone to it can be because of stress or nerve-related stress, because all those things create flexion and tension. So that could be it. I got it from early years of manual therapy. So I graduated from PT school, and I wanted to be everybody's superstar therapist, and I was like, oh yes, and I was using my thumbs to help do all of these, and I just, over about 5 years time, it just went down. And now when I do manual therapy, I always use tools, which is what I should have been doing when I was 22, but I didn't know any better, or I didn't think I'd ever end up with an injury like that.
Right.
But I didn't think you'd live this long in this system either.
But using a ball like this, like the lacrosse ball on that fatty part, can be oh so painful, but oh so helpful.
Okay.
So you're just going to find that bony prominence, and you can kind of do it on a desk or on the floor.
Oh, okay.
As you're doing it, I'm going to use my knee. So as I'm doing it, to be able to really target, and because there's layers, that bone gets hidden by that thick thenar muscle. So you're going to kind of pull the thumb up.
Ooh.
You're mean.
Yeah, that's PT, physical torture, pain and terror. That's what it's all about. That's right. So you find that, and this is something that almost everybody can benefit from, because everybody's got some level of tendinitis happening here. But some people more than others. And so you just find that little area, and you just kind of do some small circular motions right there. Can be super helpful. But just, you're really trying to, the focus of what you're trying to do all the time, Sharonda, and make sure you do this in the morning, every time you wake up, because when you're sleeping at night, that muscle shortens because you've had your thumbs in this gripped closed position. There's just
Okay.
no doubt about it. You know, you're resting for 8-9 hours in that position. So when you wake up in the morning, it's super important that you extend your arm out like you're asking for something. So this is a beggar stretch. We're reaching our hand out to ask. Then we're just going to pull the first, work on the fingers. So use that, take your hand and put it on top, like you're giving yourself 5. There you go. And then use that hand to pull those fingers back. Okay, so we'll start there. This is super important to do in the morning. Extend your elbow. Okay, then find where your problem areas are. So we're going to kind of let go of all the fingers and maybe just do the first 2, your index and middle finger. Maybe we're going to just hold on to the index finger. Maybe we're just going to hold on to the middle finger. Work our way to the ring finger. That ring finger has a whole separate tendon complex that it deals with, so that's an important one to work. Pinky is usually not too bad. And then go to this bad boy. So then get your thumb. Make sure that when you pull your thumb, you're not pulling towards your wrist. You're kind of pulling a little bit out towards the outside of the arm and elbow. And then, you know, just really get that area opened up in the morning. Stretch it out so that it's ready to rock and roll for the day. Find yourself a little ball on that table where you have your coffee. Kind of work it out a little bit. Sometimes the ball can be a little bit, you can use a golf ball too if it's feeling like it's moving all over the place. And then another thing that's very helpful over that little area, if you haven't done it before, is just grabbing a block of ice with a paper towel and then doing an ice massage. So you're just going to open up that area, find that little bony surface right there, and then you're just going to keep your ice right on that small area, your ice cube, and let it melt down your arm. And you're just going to do that a little ice massage for about 3 minutes.
Do you rub it in? Like, do you push it in like you do with the
No.
ball? You're just icing it.
Just icing it, but it's just a more
Yeah.
intense ice because it's just right there on that
I think that stretch will
small
work
area.
really good
Yeah, that should help.
because I do feel a difference.
That hurt me all the way in my shoulder blades.
Yeah,
I feel a difference. I like that shoulder blade exercise.
yeah, but it will definitely improve the more you work on extension, the more you open up, because we didn't even talk about this, but there's a lot going on with your nerve. Lori mentioned having thoracic outlet, so your whole thoracic nerve component that comes through here, that's a very big deal when it comes to what we call neural stretching. So there's lots of ways that we can do nerve stretching through here. Your radial nerve is a component there. In your thumb, so there's radial nerve stretches that you can work on. All that's going to help release the muscle tension of all the muscles that are supplied by that nerve. Because if there's nerve tension, which most all of us have, if you isolate where those nerves, if you stretch those, do the right mobility for those nerves, then you'll help to relieve tension to the muscles that those nerves, specific nerves, supply.
There's so much to learn.
I know. We are wonderfully made.
Oh my gosh, I'm a wreck. Oh, walking wreck.
Hey,
I
Gail.
have a question. Yes, I have bursitis too.
Uh-huh.
I get it in different areas, but right now I have it behind my knee.
Uh-huh. Underneath
That's a whole nother class.
Is it? Yeah. So that's a whole nother class then.
Well,
Or
that's a
you
different.
can get with Joel, and he'll help you. I know he will,
I
because
sure will.
you're anti Gail, right?
Yes, I sure will. I'd like to know more about that. Yeah, for sure, Gail. Like where are you? Like, is it under your kneecap, or actually, like you're talking about, like underneath the
Right.
behind?
Yeah, underneath. I thought it was a growth
Uh-huh.
because I couldn't. I thought it was, getting kind
Right.
of nervous. But the
Right.
doctor said that I have a bursa sap or something behind there.
Yeah.
And I know I suffer with bursa a lot of times,
Right.
in my shoulder or my elbow or.
Right. So
Which
again,
I know.
that's an area that's going to be improved by increasing your mobility. A lot of times the constant the more knee flexion that we've had, which is sometimes a result of more sitting, or just not having the flexibility in your hamstring tendons as much, can be very helpful for that. Then we can also introduce this into your life, which is
Another pain device.
Yeah, another pain device, but these are very helpful. Originally we call them foam rollers, and now they've come up with all kinds of torturesque ways of making them more painful. Because I was school, all we had was a piece of styrofoam, or it really did foam that you could even get from the fabric store, and now they have all these little cool things. But they basically, what it's going to allow you to do is when you're sitting, or on the floor, you're going to be able to use it underneath to help work out some of the soft tissue knots and poor areas of circulation, because that's where that inflammation comes from that can cause a bursitis, is because of muscles that have developed thickening of collagen around them, and they're preventing good blood flow. So yeah, that's one way you can work on that.
Can you get those things at Walmart or Target too?
They all sell them.
Them
I
there.
mean, Amazon is your best friend right now. I mean, but yeah, you could just go on, type in foam roller.
What inches?
There's not, they're pretty, it's pretty standard size. Let me see.
Can I ask you a question?
Sure, go ahead, Deborah.
Um,
And these are super good. One quick question, Deborah. This
Sure.
is not, this is one of those things that I will use in instructional videos and with people for, I mean, we talked about posture, but I didn't have an opportunity to get down on the ground, but do a ton of stuff for posture, upper back, mid back,
cool.
buttocks, glutes, hip flexors. I mean, it just goes on and on. The calf. It's gonna
That's
really be a helpful
amazing.
tool to have. Yeah. Go ahead, Deborah.
Some of my coworkers, when we were at the office, one had a big ball that she sat on, and another friend of mine has one that you kind of sit on your knees on. It's supposed to be. Are there any particular types of seats that we should be sitting on in front of a computer that's better?
There's a lot of things like, so yeah, you talk two ergonomic positions, the knee seat, the kneeling chair, the ball can be helpful because it helps you to be able to keep your pelvis tilted in the right direction so that you don't relax and lose that control of your core. Both of those are great. It's just, I think when it comes to that, it's finding what really works for you, what's comfortable for you. But the key to any seating is to not sit for too long.
Okay.
So, you know, really if you're in the office, to try to come up with ways that you can fluctuate between, you know, sitting, make sure that you're up every hour, taking at least an 8 to 10 minute stand, walk around. My ideal setting is for people not to sit for longer than 30 minutes. So I like to encourage people to do 30 minutes. And some people really do. There's knee issues, you know, lumbar issues that can cause it to be difficult for a person to stay standing for 20 minutes, especially in one position, even if you are doing a lot of weight shifting. And so we get that. But, you know, standing up and sit for 5 to 10 minutes can be another alternative. People can, you can build up your desk through books, through a crate, a simple way that you could pull up something to put your computer on. But, you know, and most employers recognize the need for that, so they don't mind sometimes investing in the $50 stand prop on top of the desk.
Thank you.
Thank you so much for taking care of us today, Joel.
Yes,
I really,
this was awesome.
yeah, I really
glad.
think that I'm going to have lots of benefit. I'm going to have to watch it again because even though you went through you said all the exercises again, I was like, oh, I forgot that one and that one and that one. So
Yeah, it's a lot.
I'm
Right?
going to watch it again.
Yes.
And so we appreciate you being here. And I am going to stop recording.